I am 34 years old, I am a woman, clearly, and I have had a hair transplant. I had hair transplant surgery done over 7 months ago due to my traction alopecia. And since launching my hair transplant vlog, I've had so many comments and questions on YouTube, on Instagram, through my email, asking me about my hair loss experience, my hair transplant experience, where I'm at now, how things are going. It's been amazing growing this channel and getting to meet so many amazing, beautiful, smart, and talented women who also are experiencing hair loss and feel like there's a stigma to it. Now, so many women in the world experience hair loss and so few of us talk about it. But what I want to talk about today is what you need to do if you're experiencing hair loss before you even consider a hair transplant. Sometimes when we start to freak out about our hair loss experience, we can really kind of get on a surgery train real fast. And I want you guys to stop for a minute and watch this video, because there are a lot of things that you need to do before you even go down to the very extreme path of surgery. In order to help me out with this, I brought in my friend and hair transplant expert, Matt Dominance, from the YouTube channel Matt Dominance. This guy is amazing. He actually has a consulting company that helps people navigate the hair transplant world, helps people achieve the hair of their dreams, and he also has a wealth of information online all about therapies, remedies, what you need to do, hair transplant results, all of that stuff. So if you guys need a great resource for hair loss related content, then you need to go check him out on his channel. Let's get started with our steps. Step number 1 is to not freak out.
Step number 1, don't freak out, because it doesn't mean that you are going bald automatically. It just means that if you're losing hair, your hair is now being replaced with new hair, and that's why you experience hair loss.
First of all, before even considering hair transplant surgery, you also need to do step number 2. Figure out what kind of hair loss you have and if it's temporary or permanent. This is vital because there's actually hair loss that is not permanent hair loss. So it can feel very jarring in the moment, and you can really feel like you're going bald in the moment, but it's just temporary hair loss. Telogen effluvian is a really good example of this. What the heck is that? Telogen effluvian is the name for a common cause of temporary hair loss due to the excessive shedding of resting or telogen hair after some shock to the system. It can affect people of all age groups and both sexes. Now, the takeaway message here is that hair loss is temporary and it actually will come back. Now, there is a whole scientific reason behind this, and it has to do with anagen, catagen, telogen phases of hair growth. I don't want to completely bore you to death. So if you are interested in the science behind telogen effluvian, or if you think you're going through telogen effluvian and just want more information on it, then leave it in the comment section below, because if I get enough comments wanting to know more about that, then I'll definitely make a video for you guys on it. So some typical triggers of telogen effluvian, the one that I see the most often in the salon is childbirth and postpartum. After your baby is born, a lot of you guys experience a ton of hair loss. Don't freak out, like just chill for a sec. You just had a baby, your world went upside down. I get it, it's really freaky when your hair then starts falling out, but you just need to chill for a sec, because that is due to like a hormonal change. That's due to a lot of internal change. And that's just telogen effluvian. Your hair is gonna grow back, and you're gonna see it grow back in these little sprouts everywhere. Here are some other reasons for you guys. Acute or chronic illness, especially if there is a fever, can lead to temporary hair loss. Surgery, an accident, psychological stress. This is very true. When I was going through my divorce when I was younger, that really led to a ton of my hair loss. Mine ended up being permanent because there were other factors as well, but it really definitely increased my hair loss when I had a lot of psychological or emotional stress. Right now with COVID, there's a lot of psychological stress. So if you are experiencing hair loss right now, it could just be because of that. It could be because of weight loss or an unusual diet or a nutritional deficiency. such as an iron deficiency. There are certain medications that can cause temporary hair loss, endocrine disorders like hypothyroidism and hyperthyroidism. I have hypothyroidism, another reason why I had a lot of hair loss, and even discontinuing the pill. Again, huge hormonal shift in your body that could cause hair loss as well. Let's go back over to Matt and see what he thinks about step number 2.
Step number 2. You have to find out, of course, what's causing that hair loss and whether it's temporary hair loss or a permanent type of hair loss. Only then you can start actually like being worried or whatever, and you can also start treating the hair loss with appropriate treatments, because each type of hair loss comes with different ways of treating. If it's just a temporary hair loss, it's going to be different treatments. If it's permanent type of hair loss, there are going to be different treatments. If the hair loss started happening like out of the sudden, and it looks like one or maybe like many patchy spots on your scalp, which may be even like diffusely thinning, it's probably just the telogen effluvium, which sometimes may even correct itself without any medical intervention whatsoever. For example, by doing crash dieting, as I already said, highly restricted low-caloric diets which are poor in key nutrients, they can cause sudden hair loss, like pregnancy, going through sudden stress, having a surgery done previously, or having high fever disease. Now there are some studies or claims about coronavirus causing hair loss. So these things can all cause sudden hair loss, which on the surface may look like diffuse thinning, okay? But such hair loss only lasts usually 2-3 months, and then your hair will grow back and it's gonna look as before without any loss of the thickness of the hair. However, if the hair loss kind of goes on for longer than 6 months, then it's usually a sign of more permanent type of hair loss, which can be either androgenic alopecia, if you are a woman, female pattern hair loss. It can be some type of scarring alopecia, like cicatricial alopecia. It can be traction alopecia caused by mechanical stress, like pulling on the hair, or alopecia areata. Then, step number 3, it's key to visit a dermatologist, trichologist, or hair transplant doctor to get a precise diagnosis of your hair loss, so you can start treating this type of hair loss as soon as possible.
Now, if you know what type of hair loss you have, you need to do step number 4. Get on a suitable treatment plan as soon as possible. So for women who are experiencing hair loss, you can start on minoxidil 2%, which is a topical treatment. You could do some supplementation with zinc, iron, and biotin. Those are 3 things that you really need to have a healthy head of hair. You can also do low-level laser therapy. One of the systems that I actually use and that I've done videos for is the iRestore system. I will leave a link to that video in the comment section if you want to learn a little bit more about that. Or you can even try PRP, which is platelet-rich plasma. For men, there are 2 FDA approved treatments for male pattern baldness, and that is finasteride 1 milligram and then minoxidil 5% topical treatment. You need to control your hair loss before you even consider getting a hair transplant, because if you have genetic forms of hair loss, you could literally go get a hair transplant and then just lose all of that hair again, along with all of your money. If you have done all of these things and you still want a hair transplant, then let's move on to step number 5. Do your research and make sure that you pick an experienced doctor and the right transplant type for you. You can get an FUT, which stands for follicular unit transplant, or you can get an FUE, which stands for follicular unit extraction. In FUE, the surgery actually requires that you shave quite a large section of the back of your head as the donor hair area, and there is a specialized cutting tool that extracts the individual follicles one by one to then be implanted into the recipient area. In FUT, there's actually an extraction of an entire strip of hair somewhere from your head where hair is growing, and then a surgeon actually divides those follicles into small groups, and then that gets implanted into your transplant or your recipient zone. If I could go back in time, and if I knew then what I know now, I would have definitely chosen to have an FUT over an FUE. If you want to know why that is, then leave it in the comments section below and I can make a video explaining why I would have preferred that method of transplant for me individually. If you have any more questions, then leave it in the comment section below because Matt and I are going to be meticulously checking those comments and we can get back to you as soon as possible.
Yeah, just comment below. I will check out the comment section of this video once it's going to be published, and I'm gonna also interact and answer some of the questions that maybe I didn't answer with your questions, and yeah, help you guys that way.
Thank you guys for watching. If you want to see my hair transplant experience in real time, then go check out this video next. I'll see you in a few days.